trying to be anyway. But talk about, an overview of the book and give us the reason why this is such an important topic.
I mean, yeah, it's a great question, and it's just for so many reasons. I mean, first of all, you're right. I mean, traditionally, the mindset of schools were that, there were institutions of higher education, and so if you had things like mental health concerns or things, that just wasn't something the university would be a part of. So you just had to figure that on your own. Um, and so, but the dynamics, like we mentioned, the dynamics on campus have changed so much. I mean, now what we're seeing is so many students, more and more every year, that are coming to campus with high mental health needs. And so it does bring kind of a new consideration about what is the role of the institution. Because on one hand, we're still institutions of higher education, but on the other hand, there's so much opportunity there. I mean, if you're a college student between 18 and 25, the traditional college age years, that's the time where most mental health problems are either going to emerge or escalate. So that means that's also the best time to treat them. Because if you can treat them right when it emerges, the success rate is so much higher, and you literally can change the trajectory of the student's life. Like if you wait 10 or 15 years after that, it's going to be a lot harder and may not be as successful. So just the fact that we had access to that much, to that vital of a demographic, shows that with the opportunities that we have. And yeah, even like we said, I mean, our mindset is if it affects what affects the person, affects the learner. So if you want students to really excel to academics and be the best person they can be, you really need to look at the mental health concerns they have, and can you figure out a way to actually kind of meet those needs. And so yeah, there is just kind of that dynamic that campus have changed so much, and we're seeing these new influx of students with high mental health needs. And so the question of, well, how are students going to respond? And the book is really about that. The whole topic is like we can't change who we are. We're still an institution. We're not a hospital. We're not a treatment center. We're not this, but we can work with them. We can work with hospitals, we can work with treatment centers, and we can basically combine our infrastructure. We can combine our infrastructure that we have facilities, we have access to the clients at the right time. We're literally right where they live, right where they work. And then the treatment centers, they have the infrastructure, they have programs that have been proven to be effective. They have their staff. There's literature about how good it works. So if we can just build that bridge between them, we could do a lot of good.
Yeah, I can see that. I mean, I can see where I love the idea of tying this to, if you help them deal with the things they're dealing with here, they will be better learners, right? And you
Mhm.
also learn how to cope with. I mean, I know it's taken me until I was 53 to deal with my ADD, right? And so um, if I'd have had that help early on,
Mhm.
like with counseling or with therapy or with whatever help, I
Mhm.
could have probably done better, right? And learned how to cope earlier and how to have strategies, right?
Oh, I would absolutely agree. And I think that would carry over not just to academics, but just kind of your worldview and maybe how you see life in general, if you just kind of
Right,
learn that skills. And who better to kind of reach you than a school at that point,
right.
Because you're right there, you might live right or work there. And if we had access to you and if you just connected to the service, again, could have made a world of difference.
Absolutely.
What what I really liked about the model you've sort of outlined, and I'd love for you to go into just a little bit deeper,
Okay.
is uh, it's a true collaboration
Hmm.
with the students, with the community, with the teachers, with the parents. I mean, it's not a I'm going to solve all of your problems situation. You're, right? Am I understanding that correctly?
Oh no, you're absolutely right. Because that's the thing. I mean, so many times, people want to put the expectations on the school too, and it's like, everyone's going to have limitations, and so we really want to combine different, sources and resources, because if we have a combined effect, then we're going to be more effective. But yeah, if you want me to go dive deeper into the model really just based on kind of the data and the literature. Like we call it the new narrative, because if you do any Google search about college mental health, it's probably going to be negative. It's going to probably hear some stories about schools being overwhelmed with students, and there's nothing that the schools can do about it. I mean, that's the narrative that kind of is pervasive right now. And that narrative, honestly, could be dangerous, because obviously the people who are writing those headlines aren't college mental health professionals, but it could actually erode the confidence from our students and from our stakeholders like parents. So really, instead of just kind of automatically just endorsing that narrative, you looked at the data and said, okay, what does the data actually say? And we found 4 key points, and each of our narrative was about those 4 points. That's why the book's called Four Objectives that Every Counseling Center Should Attain. So if you want me to go through it, like the first data point is basically saying it's a finding that counseling centers, we were spending about 50% of our resources on 20% of clients. Okay. And these are the students who are really high mental health needs. They're coming into campus. They usually have a history of mental health concerns. Maybe they've been in treatment before. I mean, these are students who, again, high need. Like for an example, 50 years ago, if you were diagnosed with bipolar, you probably didn't go to college. Now it's very commonplace. So, so we have students with very high mental health needs. And so what would happen is the traditional mindset would be, we're a school, we can't help you. So we refer them off campus. So one, they may or may not go off campus, but two, they're still on campus. They're still in their res halls, they're still in class, they're still in student organization. So we kind of created this dynamic where the counseling center were saying, you're beyond our scope of care, but then the only people who's interacting with them are not the mental health experts. They're like the RAs who are other students and deans of students and professor. And that dynamic just wasn't working, because what would happen is somebody would get concerned about the student, bring them to the counseling center. We would do a safety assessment, refer them off campus. They don't go again. Then someone else gets worried about them, brings them back to the counseling center. And we're doing all these safety checks, and it's not treatment, it's not counseling, it's just not working, or we would try to absorb them. Like we do short-term counseling, but we feel bad. So we have a student with high mental health needs, and we're just like, hey, we're just absorbing you into our model once a week counseling. But they need more than that. And they come in crisis and crisis and crisis. So our first objective was, okay, what if we had services for those 20%? Instead of just referring them off campus, what if we actually said, we're going to actually have dedicated services for them? Would that make an impact? Like, would that help the counseling center? Would that help the RAs, the professors? But could there be an opportunity where that would work? And yeah, spoiler alert, yes, it does work. But the question is, how does it work? And the ideal is, well, you can't ask the counseling center staff to do that because we're already at capacity. But then there's no reason to do that. Like I said before, when you have these treatment centers who, are nearby, will come to our campus and have these programs. And so why don't we just collaborate with them and use their program for us? So that's the first objective. The second one is a finding that we found is that most of our clients in any counseling center, our students, they've been here before. Like they're actually returning clients who have come back. And, on one hand, that's good, but then it does beg the question of what type of aftercare services are we providing? If you look at the field of substance use, everyone knows you don't have to be a therapist, but if you have a student who's in the middle of the addiction cycle and they go to counseling and it works, and let's say they're sober for a month, if they stop counseling, everyone knows what's going to happen. They're most likely going to go back to the addiction cycle and need counseling all over again. So we took a really hard look, and I know it was a criticism of the field, but we were like, why don't we do that with everything? I mean, especially like depression. Like we know depression and anxiety are episodic, okay? So if we know they're episodic, but yet if we really were honest, if a student comes with us with high depression, we get them in symptom remission, and then once their symptoms are low, we kind of stop because we're so busy. We need a slot. We have other people waiting. So we just kind of terminate sessions and we wish them well. Well, if they come back, why should we be shocked? So our second objective is, okay, we need some type of aftercare program. And then the question is, well, what would the aftercare look like? Well, like I said, there's already an established literature in substance use, and substance use counseling is just a phase. After you go through counseling, peer support, and living a life of recovery, that's normative. Like that is what you do. And so we said, what if we had that mindset for everything, for depression, for trauma, for anxiety, for everything? And so that's how our peer support community started. So that's our second objective. Our third objective is that if you look into counseling center, the staff, all the services, it's high burnout. Staff therapists are burned out. It's very high. And if you look at the source of the burnout, it's going to be students with unscheduled appointments. And now either they're in crisis, which by definition, you can't schedule those, or they just show up, which is actually not uncommon. If you're dealing with an 18-year-old, they don't usually call ahead and say they're depressed. They usually just, suffer in silence for a while. Then all of a sudden they just walk in and say, I'm here. Well, that's really a source of stress because we have our set schedules and now we have these people coming in, they're in crisis or whatever. So one of the things we said is, could we just reorganize our staff and realign it And what if we had staff who all they did was triages and crisis? So they don't have a caseload. They're just waiting for students to come in. And the idea is, would that provide better customer service? Because if I'm on rotation once a week. So any follow-up would be the next week. But if you're in crisis, maybe you can't wait a week to see me again. But if I have a therapist who doesn't have a caseload, they can see you tomorrow or the next day or the day after that. And if I have a team of them waiting, like 4 or 5, instead of you coming and waiting for me to be free, like what if I have 2 other students? But if I have a team of 4, you're probably going to be seen immediately. So that's the third objective, is having the dedicated services. And the fourth objective is, we found, as a lot of students were meeting with the therapist for things that weren't clinical. They were like homesickness, test anxiety, time management, which is, yeah, we could use it, but is that really the best time of a psychologist PhD level? So we partner with our campus providers like student activities, student success, to really have a formal bridge to help those students. So those are the 4 objectives. I know I talked a while, but our model, like we have a learning network, and we have like over 80 schools in that learning network. And that's what we say is, like, you don't have to copy everything we do, is that you just agree to adopt the model, and we work together to figure out other ways to meet each objective, because there's different ways to meet each objective.
So in the research, when you were writing this, did you discover anything that was surprising or counterintuitive that it'd be interesting to share?
I think it was just, the first point that, we were spending 50% of our resource on 20% of our clients. That's just a capacity issue. That's a huge thing. I was like, oh, wow, most of our capacity is going for like 20% of students. And so that was the thing that jumped out, like, oh, okay, that is a way that we can increase the capacity of the counseling center and make a campus-wide impact, without spending any money, because if we collaborate with the provider, and the way we do it, that collaboration, our, tuition doesn't cover that, but the cost of the copay is so much less expensive than building a building or hiring a new therapist. So really, when I looked at that, and I was like, wow, if I collaborate with a couple providers and have 3 or 4 programs, I can see so many more students with high mental health needs, way more than the cost of hiring 5 or 6 new therapists. And so realizing, okay, there's a different way here, because what schools are trying to do is just hire and hire and hire. Well, if you give me 5 new therapists, that's great, but my campus has 12,000 students. How much of an impact is that going to make, But if I collaborate and have 5 programs for a fraction of the cost, I'm going to make a way more impact. So that's the one thing that really kind of changed my whole mindset, is that we're just using existing programs and existing resources, and building a bridge is a way more effective thing than building our own kind of program or building or things like that.
Yeah.
That's a lot of looking at like real data and then trying to find a solution, which has probably definitely been overlooked for quite some time, right? Because I've spent some time in this space, and it has been overlooked. It's always solving the problem at hand. It's not solving the problem overall. So I'm curious, like, how long it took you to get to a place where you were making real change.
I think this is one of the things. It's funny because I've been at TC since 2007. I became a director in 2019, right before the pandemic hit, And actually, my director is now the clinical director, so we flipped, and I told her, I was like, you knew something was going on, because the semester after we flipped, we had the pandemic. But I say that because the pandemic really was a catalyst, because our numbers were going sky high. The year after, we had a 45% increase. The year after that, we had a 48% increase on top of the 45% increase. Most schools were dealing with budget issues, financial issues, enrollment issues. I knew I couldn't go to my chancellor and say, I need 100 new therapists. I just knew that just wasn't going to happen. So it almost forced to figure out, okay, we need a different way. And that's really dive in, okay, what would be most effective? What does the literature say? What things that we could do? So I'm not saying the pandemic was a good thing. I'm definitely not going to say it had a silver lining, but I will say that was a catalyst to make us say we have to do things in a different way. Like the way that we're doing the traditional way is just not going to work for this. Like there's no way we can stay afloat with that traditional model. So we just kind of, out of necessity, had to adopt a new one and make a new one.
So when you say programs, did I interrupt you, Cynthia?
No,
Sorry.
go ahead.
So when you say programs, so you've gained 5 new programs. So does this mean that you can actually, let's say that there is an addiction issue or a depression issue, anxiety issue, so you can get them into a longer term, in other words, a more normal arrangement, a more normal care regime by having those outside partnerships. Is that what you meant by that?
Yeah, but even more so, we have those partners come to our campus. So, I mean, so give you a mindset. We have a treatment center 15 minutes away. And Cynthia, you heard me say this story a lot, but they have, a behavioral health intensive outpatient program, which is 9 hours therapy, 3 days a week. We're actually lucky to be on a campus with that 10 minutes away, 15 minutes away, but it's still a hard sell because you're telling family members, I mean, it's a mental health hospital. So you're telling parents, send your child to a mental health hospital, which is a hard sell. Second of all, they may go and you don't know who they're going to be in group with. They could be in group with someone who has grandkids talking about child custody and they're 18 years old, so they just can't relate. And then by definition, they're disconnected from the university. We send them to, we don't know if they go. They can go, leave AMA against medical advice. They may drop out. They may go. They finish. We don't know when they're going to finish. So the whole point is not just to have, okay, your referral, we're going to do that. We went to that treatment center. It's like, would you have the IOP actually on our campus? So that way, students, one, it takes the stigma away because they're not going to the hospital. If they come, they're going to be with other students. So they're with relatable peers. And we know exactly what happens. We sign releases, so we know that they're going to go. We even include our deans to give academic support because it is 9 hours a week. So we're very well kind of versed in what happens. And so then that treatment center, again, it's their program. They just bring one of their staff members on our campus. And we have weekly meetings with them. So they literally become part of our team. And that's what I always say. Is like I always say, collaborations when you partner aggressively. Cooperations is passively. You agree, but no, they're part of our team. We meet once a week. We have a disposition. We know. I mean, we literally consider them as part of our team. We're not paying for it. We just give them the facilities, so they have no overhead. They have no cost, and we give them access to our service, so they have a referral stream, and it's been a win-win-win situation. And then the students can have it because they don't have to pay as much because we're able to offer something to cover a stipend for the copay because that's very less expensive covering a stipend for a copay than trying to build our own program.
Is there any stigma that they have to deal with, you think?
Any stigma, you said?
Of doing that on campus?
My experience is the opposite. The fact that it's on campus opens the door and makes them more willing to try it. Because, like I said, in our experience, we have one 15 minutes away. They wouldn't want to go because of the hospital. But if you say it's on our program and we can promise that you're only going to be here with your peers, then there's no stigma. I mean, it actually makes a family more likely to do it. It makes them likely to do it. Especially if you throw in the, hey, we'll give you a stipend to help cover the copay, that actually kind of increases the motivation as well. So I think it actually is the opposite. I think it helps with it.
Yeah, I mean, just thinking back when I was in college, anytime I had to leave campus, I don't care if it was for lunch, it was like a big deal. It's so hard to get back on, I mean, even just that, the exiting and coming back is like, it could throw a wrench in your day, especially if you're dealing with any kind of.
Oh, and you're talking about 18, 24-year-olds. I mean, I'm not to be stereotypical, but a lot of them, our health center director would say, they don't even like going to the health center when they're physically sick. They just don't go. So can you imagine them trying to go to the counseling center? There's a lot of, I don't want to choose. So it goes back to the narrative. The narrative is like, there's nothing wrong. You're not like crazy but we kind of, our narrative is this is the opportune time to do it. If you do it now, between these ages, you could be on a whole different trajectory. Where if you wait 10 or 15 years from now and it gets more ingrained, you have more consequences, it's going to be harder. So our whole narrative is like we set it up where we try to get rid of all the barriers to access and make it like you're just here. All you really have to do is just agree to come. We'll help you do with their academics, with the stipend. And if you really do it, it's a potential to really better your whole life.
Do you have any numbers or around like if students would go home and leave campus for treatment, do they come back typically?
Yeah, I mean, so I mean, our retention rate kind of went up, and so like for example, for us, what we would do is that every year, so what our process would be is like when the students would come in, we would ask them, are you thinking about leaving the university, and is that why you're here? You know, and so and we did a Likert scale on a scale of 1 to 4. So what we would take is a 3 to 4. So students who score 3 or 4, that means they're really thinking about leaving. Like that's a serious concern, and that's why they're here. So we looked at that, and I haven't actually published it yet. But when I was the one who did it, because I was clinical director at the time, our number was about 65%, which is actually really good. Like we would keep students who were thinking about leaving the university for a mental health reason, we would keep about 68%, 65% of them. Okay. Well, in the last year, the number went up to 88%. Okay. And because of all of our programs. Again, we're going to have students, even when we have these programs that are still high need, they probably need a residential, they probably need it. So it's never going to be 100%. But that is like a 13% increase. And that's retention. So those are students who actually stayed on campus. So that's kind of the biggest retention data that we have. But yeah, I mean, it's not uncommon if students leave, for medical withdrawals, maybe they don't come back. The family sometimes will just keep them, at home because of concern and everything. And that could be a stressor, having to be disconnected from your school, and the feelings that brings up. So yeah, I mean, all of our initial data, like I said, we've been doing this for a couple of years now, but all the initial data is pretty promising.
So, looking at the big picture here, is there an overall message then from this book and from this research that is a really kind of a roadmap for other institutions, other universities to follow, you think?
Oh, yeah. I mean, the message I've given to government officials is everything is okay. Imagine if every college did this. I mean, imagine if it was normative that if you were a student and you had a mental health concern like a substance use or a behavior concern or an eating disorder, if there was a program on campus that you can get treatment for, imagine the impact that would have on society. I always talk, about the people say the mental health epidemic in America. Where would you start in terms of reducing it? To me, colleges and universities where you would start because there's a system, there's an infrastructure, there's a vital demographic. And yeah, it wouldn't be a catch-all end-all, but if you could do that, you would make a dent. And it might take a couple generations, but you would definitely make a significant dent. Where if you try to go, I mean, there's been state agencies that have a community program, but they're in a community where the community doesn't trust the government or doesn't trust mental health. But for us, we don't necessarily have those concerns. People come to us. So there's so many reasons why, like if every college were to do this, what would be the societal impact of that? So I think that's absolutely huge. And again, there's different ways to do each objective, but if each school just adopted those objectives, I think you're making a huge impact right there on society.
And your book also just is all of the proceeds go back to the school. Is that correct?
Yeah. So, I mean, one of the things that's been very touching for me is that, like I said, when students come, tuition is not going to cover that. So there's just the cost of the copay. We've had a lot of donors step up and say, for the first couple of years, they've offered to cover that and pay the cost of the copay. And I can't write the checks that they write, but I can put this, and I know that there's a lot of administrators in schools and colleges that want the book, and like I said, we have a learning network which over 80 schools, and so I was thinking to do my part, I could take 100%. Like if you're gonna buy the book, it doesn't go to me, it goes right back into our services. So it gives student stipends to receive these specialized services on campus. So that was just something that was touching for me because I know the impact. I mean, the story about when we first started this, and Red, I could tell you this story. We had about 3 weeks into the IOP program, our behavioral health IOP. I'll never forget this. I say this story all the time. I was working on a Wednesday night, and all of a sudden I got a call, and it was from a dean of students, and the professor was worried because the student really said a goodbye email and said, I'm going to jump off a parking garage. And so, yeah, worst case scenario. But then I get a call from the campus police, like maybe 5 minutes later. And the police said, we have a mom on the phone. And the student sent a text saying, goodbye, I'm going to jump off a parking garage. And it was the same name. And then a couple minutes later, I get a call from the dispatcher saying, we got a bunch of students calling that a student's in a group text saying, goodbye, I'm going to jump off the parking garage. And it's the same name. So it was worst case scenario, right? I mean, technically, we don't even know if it's on campus. We have 3 parking garages. We don't know what to do. We don't know, can we ping the cell phone? I mean, this is like, we're scrambling. And then 5 minutes later, the IOP therapist comes in from the treatment center. And she said, we have a student who started the program on Monday. And he sent an email to his professor, a text to his mom, and a group text to his friends that he was going to jump off the parking garage. And he's here right now. And so we already have releases signed. So I went right to the student. And the student said, yeah. And he said, I mean, his story was he was in one of our res halls. And he said, I was in this like brain fog, depersonalization. And he was walking to our football stadium in the parking garage. And he was going to jump off. And he said that he literally, by the path, he had to walk by the counseling center. And his story was that when he started the program on Monday, he met 2 students and they made a pact that if they ever had thoughts of suicide or hurting themselves, that they would reach out. And he told me, so when I walked by the counseling center, he said, I knew those 2 guys would be in there. So I walked in there instead of going to the garage. So right then I was sold. I mean, I was just like, okay, yeah, again, that program is the same program that's 15 minutes away. But had it been off campus, he may not have gone. If he was in group with someone he couldn't relate to, maybe he doesn't make the pact. But the fact that he literally had to walk by the counseling center, that saved his attempt. And so that just created a passion in me. I was like, okay, we are doing this. And I mean, even if it was just for that one student, it's enough. And so there is a way for me to contribute, to give back. And yeah, I've been given this presentation about our objectives for years, talked to literally over 100 schools. It took maybe about 6 or 8 weeks to write it and edit and to format it. And I was like, if that's one gift I can do, just give it back, I'm happy to do it.
Well, and it's not going to be one life. That's going to be compounded by many.
Yeah, and we have other stories. That was just the first 3 weeks of the program. We've been doing this since 2019. So yeah, we have other stories like that where it really does make a huge impact.
I mean, I'm in such, I have a 2-year-old, and so I think about that. I'm like, I wanted to get there and read. I know you have kids in college right now, and you just like hope that there's someone like you there doing this for them when they're in those moments. And so it's you just completely have I think sort of intentionally solved a problem and unintentionally used a very big futuristic narrative of cross collaboration, right? And like decentralizing these power structures that have kind of kept everything so organized that we haven't been able to help each other. And that story is just so beautiful. It's a perfect.
Well, I think it comes down to, I mean, it's even more in the sense that I think we almost have a responsibility to do this, right? Because I mean, I think you're right, Eric. It's about. And this is when they're going to experience some of the harder times in their lives. Like I said, I've got a freshman in college and a rising senior in high school. There's more responsibility. There's the weight of knowing what's coming, right? Adulthood and jobs and expectations. And there's a lot of pressure today that I don't think I really had when I was younger, right? I think that there's a lot more pressure in society and there's a lot more anxiety. I mean, these things right here, they're killing us, and so I think, I mean, we almost have a responsibility to do this, and I think, I mean, I see your passion in it, but I feel like really, because we're not taking care of mental health outside of, we're not doing a very good job of that in society, and if we can do this early, like you said, I mean, we just should.
Yeah. Oh, I absolutely totally agree. And I mean, you can throw any statistic about the college age population, about being the second leading demographic for suicide attempts, high demographic for eating disorder, first depression, developing addiction, emerging. And yeah, I mean, I do think if there's a responsibility, if you care about society and kind of our fellow people, what do you do about it? And then I think colleges and universities have been overlooked because, I mean, I think colleges felt like it was just their responsibility, but it's gotten so big, it's like we can't do it alone. And then the fact that if we could develop bridges, or colleges, instead of saying we're going to fix it all by ourselves, just open up and say, hey, we want to build these bridges with the state agencies, with the community health, who already have these programs that already work. And we're just, like I said, combining infrastructures, using their infrastructure of the program with our infrastructure, with the facilities and the access.
How easy was it to convince these businesses? Sorry if I interrupt you, but how easy was it to convince these businesses to do this?
Very easy. To give you an example, we have like partners with other schools, right? A lot of our schools are in rural areas where there's nothing, right? That's one of the things that we're actually getting attention, because we're able to entice treatment centers to go to these rural areas, because they can open a clinic for this campus that will get them in the black, and then they'll open another one for the community, or even help and do both at the same time. So yeah, if you want to talk about another problem, is that these rural areas don't have any treatment centers, but they have a school, they have a campus, a lot of them, small college town in the middle of nowhere. That's the perfect way to entice a treatment center to go there. So that's been another fallout that's been unexpected. But yeah, I mean, treatment centers, I mean, if you think about how much it costs, I mean, what the deal that you're giving them no overhead, a steady stream of referrals for a program that they already have. I mean, I've never met a treatment center and said no to that. In fact, most of them are jumping at the chance to work with us. I get vetted solicited all the time from treatment centers, you know, to work with our schools. So yeah, if you look at the numbers, it's a win-win-win all around.
And yeah, no, I can see those treatment deserts have always been a huge concern. It's like, oh, someone has a problem, send them home to the middle of nowhere where they can't get any treatment, and they're just back in an environment feeling like, you know.
Yeah, they're in a rural area, there's nothing there, there's no treatment center, but yeah.
You know what I really like about this too is that during COVID, we had this sort of epiphany. My team and I were like, well, you know, we need to do something, like, right? And we realized there's probably a lot of people out there who want to do something, and they don't know what to do. And we were like, what if we presented these clear ideas? And you've done just that. It's like, here's how you can help. We need to cover these copays.
Yeah.
Well, that's a way where you feel like you're participating in a solution and this problem is so big, it's easy to just shy away from it altogether. So,
no, I think you nailed. I think that's the one thing, I think is kind of the most meaningful, is that we're able to articulate. Someone would say, I hear a lot of comments about the book. They're like, wow, this is so simple, it's genius. And I actually love that comment, that it's so simple, because it should be. And to me, I think that's a way, if someone reads the book and say, these are very simple ideals, and not realize, yeah, it's totally transforming the way the field and how you work. But to me, if it's a simple way, that means you should probably try it. And so to be able to articulate in a way, because I know, like I said, not just my campus, our partners, so I've seen it be multiplied in other campuses, and it's worked. No one has regretted doing this, or said it was a bad idea. Because again, for the university, we didn't spend any money doing it. I mean, yeah, we got donations for the copay, but it wasn't required to do that. The treatment centers, they making money off of us, for lack of a better term, and the students get their services without an out-of-pocket cost. So if it seems simple, that's the best compliment anyone could ever give to me, is that it's a very simple thing. I don't take that, as a critique at all. But again, it goes back to the fact that if it is that kind of straightforward, and like I said, treatment centers are willing to, colleges are willing to, students are willing to, yeah, it could be a way to make a dent in things, for sure.
Indeed.
I could go on forever talking to you. I think I have. But we're reaching sort of the end of the interview, and I know people are going to both want to buy the book and probably have plenty more questions. So could you tell us where we can support and purchase?
Yeah, so I mean, like I said, the book is actually, it's going towards, all the proceeds go towards the mental health services. So it's not like my personal website I'm going to give out or anything like that. You actually would have to go to TCU, which is Texas Christian University. We have a university advancement, which is our giving page. I can give you the website. I can email you. It's pretty long, but if you just go to that website, you can search. Even if you search TCU, my name, Eric Wood, New Narrative, you'll find the ordering page. And yeah, you can order straight from there. You can give more if you want. But once you order it, you'll get the tax receipt from our advancement because it is technically a donation. So you get all that. And then you get a separate email from me personally with the book and title.
Thank you so much for being here and sharing your wealth of knowledge. And
well, I just want to thank y'all for, first of all, inviting me. Obviously, he's enjoyed meeting y'all, but just to have this topic on you, I know your reach is huge, but to dedicate your time to this topic, it does mean a lot to me. So I give you credit and I appreciate that. And if I can be of help or look forward to working with y'all in the future for sure.
Absolutely. Thank you, Dr. Wood. And thank you, Rhett, as always, for being here with me.
Thank you, Cynthia.
And just for all of you who are watching, we will be back next week with another episode of Bestseller TV. And we look forward to seeing you then.